Hi, hope you're having a great day. Welcome to this episode 4 of the series Wellness with Experts at BeYourAwesome.in. My name is Nishtha and we are joined with Dr. Vasudha Sharma, who is an expert in Ayurveda and integrative medicine. Thank you for your time to share your knowledge with us. Let me introduce Dr. Vasudha to you first. Dr. Vasudha Sharma is the Director of Medical Services of Vivekanada Health Global, an international chain of integrative medicine headquartered in Bangalore. She is an entrepreneur in the field of integrative medicine, an Ayurveda and yoga therapy consultant, researcher, and an international speaker with 21 years of clinical experience. Dr. Vasudha Sharma has been a clinical practitioner integrating Ayurveda, yoga, and acupuncture, and her area of specialization includes integrative pain management and women health, including infertility. So we welcome Dr. Vasudha Sharma.
Namaste. Well, thank you, Nishtha. Thank you for having me over. It's interesting to be on your platform as well, because I think it's good to reach out to more people, and you're doing a great job there.
Thank you, doctor. And the topic for today is very interesting for me. I'm very curious to know about how Ayurveda is getting integrated with different forms of medicine. So why don't you throw some light on that topic for us?
So the integrative medicine has become the norm of the present era, I would say present day scenario, and the future is in integration, because when it comes to integrative medicine, what are we trying to do? We are looking at the patient as a person, so it's personalized very specifically to the patient or the client. And here we are not running a race to say, is Ayurveda the best, is yoga the best, is allopathy or modern medicine the best. So we are bringing together the goodness of each of the science so that, we give the best possible remedial measure with good results in place to the patient.
Right, and I love it because there is yoga, there is modern medicine, there is, Ayurveda, acupuncture, there is so much. As a patient, which is like one single person, sometimes you get mixed up, right? And a lot of people that I work with, they are not even aware, or there is a lot of misconception about, you can't mix one with the other. So that's great that it's coming up. And how is Ayurveda getting integrated, and with what forms of medicine is it getting integrated with?
See, what we do at Vivekananda Health Global is specifically this. So we work on integrating Ayurveda, yoga and naturopathic medicine, and in specific reference to acupuncture, maybe in cases especially related to fertility,
right,
as well. And how do we get this combination on? People should not feel that it's like a khichdi, you're just throwing few things and then giving one prescription to the patient.
Right.
It doesn't happen. So it's very much related to the experience you carry over a period of time to bring in this combination, because there is no like textual description. You're going to say, okay, in an X case, how much of Ayurveda, how much of yoga, how much of acupuncture or naturopathy you would bring in.
Right.
And in India, what we find is acupuncture is practiced by naturopathic in naturopathic medicine, and there are trained professionals who do acupuncture. Therefore, they are doctors, and people should know whom to reach out to. And similarly, when it comes to yoga, you have people who have done their masters in yoga, bachelors in yoga. And of course, Ayurveda, there are doctors who have done their BAMS. So this is how the approach towards whom you should go to should also be. And I think it's also important for the viewers to understand this because you are in safe hands. That's very important.
Yes, true. And so, doctor, for fertility, like we spoke about last time as well, that PCOD or endometriosis are very, very common issues. So how do we work in an integrative fashion for issues like this?
See, I just mentioned in the previous episode about the hypothalamo-pituitary ovarian axis. And as per Ayurveda, we talk about PCOD being a Vata Kapha disorder. So what do we do? First of all, we understand what is the imbalance at the level of the dosha. We look at the Prakriti or the personality type of the individual has come to us, and based on this, we will have to also design the treatment protocol, which involves to begin with an Ayurveda Panchakarma treatment, because the detox is very essential to restore the metabolic balance,
Right.
and therefore the hormonal balance or your endocrine balance. And without the metabolic balance, nothing is going to go forward. And Agni is one of the main element which Ayurveda describes, and the balance at the level of the Agni is very important for the person to also respond to the treatment which you are going to give.
Right.
So usually this is followed by some oral medication of Ayurveda to improve the problem, say PCOS, and then we include that with yoga therapy, which is a module of therapeutic yoga which involves a combination of breathing exercises, asanas, relaxation, pranayama, chanting. And yoga with Ayurveda will definitely play a greater role in enhancing the response, because the mind factor is taken into consideration very strongly when you bring in yoga into the treatment protocol.
Right.
And acupuncture is also used here based on the cyclical menstrual dates. We also designate the period of acupuncture. It may be between 5 to 10 days or even more, and this is going to help reduce the polycystic ovarian response, improving the endocrine functions, because acupuncture also directly works on enhancing your brain functions, and therefore the combination would give us an enhanced approach and enhanced response.
Right. And for someone who is going in for modern treatments, allopathic treatments, can they also add into their treatment?
Very much, very much. So like I said, some of them have already undergone a couple of IVFs,
Right.
and they want to take a break. So let's take this because it's a very common instance. And the doctor would have told them, please come back after 3-month break because you've already done say 2 IVFs. At that point of time, this would definitely enhance your overall health, because so much of hormonal influx has happened, so much of disruption. Maybe your immunity could have gone down. You need more space to breathe, because you are like in and out of hospitals, taking shots and just undergoing all the regimen. So the stress has also increased. You need rest. That's what you feel. This point of time, doing a panchakarma, detoxing yourself, restoring your balance, and doing yoga along with it, and prepare yourself for better outcome in the next IVF cycle is something which everybody should understand. And though we don't look at IVF process as such, we can also look at this independently.
Right.
When a couple wants to plan to conceive, I think this is more so what we need to educate people with. You may feel that okay, you are married now for 2 years or 3 years or 5 years, and now you would like to plan for a child. At this point of time, why don't you look at a panchakarma? Why don't you look at detoxing yourself? Program your body, which is fetal programming otherwise, to say that okay, I'm going to work towards a healthier offspring.
Right.
So things are not in our hands completely. We cannot take 100% control, but we can take good control to say that we reduce the morbidity in a newborn, and also improve the health of the newborn, which is very important.
True.
Because what we want for the society, we want people to contribute more, so we want puristic mindset in the society to become better.
Right.
So all this can happen much before you would like to otherwise look for a problem and look for a solution. Doesn't have to be. It can be preventive in its approach. And this approach of integrating panchakarma, doing yoga unless the lady conceives, and also practice prenatal or antenatal yoga during pregnancy.
Right.
These are some things towards a healthier future for both the mother and the offspring.
Right. And as I hear, you speak, it sounds so very powerful, because it's not just one aspect of your health that all of this will impact. It's your holistic health, and fertility of course is a part of it. You're currently thinking of an offspring, but if you take these practices, you will yourself become a healthier human being.
True.
Uplift your own energies, and therefore you will be able to attract a child. And in our program we call it a divine child or a divine soul, which is of a higher energy and a healthier body.
true, very
Right.
true.
Endometriosis is also a very common problem that we hear about in women. So, how is an integrative approach used in that case?
First of all, endometriosis is a little different from PCOS,
Right.
and the lady really has to face problem in the form of pain.
Oh.
So every month, whenever the periods come, or even before the onset of periods, she experiences quite a bad abdominal pain, and not only that, sometimes painful. Even defecation, that is while passing your bowel, also she acquaints pain. So this is something which is much more troublesome, and it can just create that fear, panic in you, because every cycle is going to be a nightmare. So addressing the acute pain has worked out very well through acupuncture. So what we do when we do acupuncture is we give them cyclical sittings, and that's really proven to be highly beneficial for all the patients who've come to us with endometriosis. And then slowly, we introduce them with panchkarma, or we introduce yoga therapy much in advance. So it depends on the condition of the patient. So maybe, in this kind of a case, we use acupuncture and yoga initially, put them on Ayurveda medicines, and then over a period of time we take them for panchkarma. Then again we continue with yoga, because yoga is not that we are going to do with them across months. We'll do it maybe for a period of 7 days, 14 days, and then we ask them to continue themselves.
Right.
And there is a time duration. 3 to 6 months, definitely we see very good responses, and the pain comes down very well within the first 1 month. That means over a period of the second month, when they get their cycle, definitely the pain intensity would have reduced, and many cases by the third cycle their pain is quite negligible.
Right.
So it finally depends on what problem they come to us with.
Right. But it's very heartening to see that, there is all forms of medicine that are getting included, and to treat the system, not really just the symptoms. So it's very, very heartening. Thank you, doctor. Thank you for your time and this powerful message that we are being able to give to our viewers. So for consulting with Dr. Vasudha, I'm going to put in all the details here. But she operates out of Bangalore, HSR layout, Kalyan Nagar, and online for those of you who are not in Bangalore. And to get in touch with her, look at the description and know how you can follow the process to get in touch with her. Thank you, doctor. Thank you for your time, and keep watching, subscribing, and following for more.